June 26th, Wrongs Part 2. um, Dude comes in with alpha 1 antitrypsin deficiency concerns. You can get genetic testing for this. They're 30 years old. All you need to do is just ask them. There's a gene called the SERPINA1 gene. That was news to me. I could just kind of just didn't know that there was a specific gene that goes with that, but that's what they're looking for there. You can test for it, no big deal. It was a good run there. Had gone 14 in a row, right? Acute myocardial infarction. So just remember that all the lateral leads being N STEMIs, they're all depressions. In like especially like V2 through V4, it's pretty easy to see that it's all depressions, but just kind of freaks you out. That's a posterior infarct. That's what they're looking for there. So you can give them anticoag, antiplatelet, pain meds, cardiac cath. It's the same way you would do if it would have been a left circumflex. You know, it's a posterior infarct. All right. So next one is dude who came in and he seemed like sort of sad, but like not crazy sad. And they're basically saying he doesn't meet the 5 of the 9 for SIGI caps. So we're just going to throw a reassurance and follow-up exam in 1 month on a 68-year-old whose wife who just died a month ago. I personally didn't love it. I knew that psychodynamic psychotherapy wasn't right. I knew that they would have done CBT if anything for this dude. But this is sort of wild to me in the sense that like you're just like kind of just passing the buck off on a dude who lost 5 pounds in 1 month. But that's my opinion. Okay, next is a sickle cell person. So just remember that sickle cell is absence of hemoglobin A and actually a relative increase in hemoglobin F. Okay, so sickle cell is no hemoglobin A. Next up is a crew kid. I hated this one in particular because they're saying that he has cough and difficulty breathing for 2 hours. But they're giving you nothing else. They're not saying he's been sick for a while. They're not saying that he's been sleeping bad. They're not saying that anything else has been wrong. They're just saying 2 hours, cough, difficulty breathing, and no time of the year, no nothing. Just mild inspiratory stridor with a fever. Okay. And that's why they're so confident to tell you that this isn't foreign body because you wouldn't have a fever in 2 hours. But good golly, you're supposed to just give this kid administration of inhaled, cool, mist, humidified air. Okay, because of 2 hours, cough, difficulty breathing, and mild stridor. Good Lord. Next up is myotonic dystrophy in a 5-year-old. We just did myotonic dystrophy not that long ago, too. But they're saying that this kid's got high arched palate, wasting of distal muscles, and hypotonia, with DTRs being intact and symmetric. What's the diagnosis on progressive muscle weakness in a 5-year-old? Of course, it's myotonic dystrophy. And they're happy to admit that typically the way that they like to give this vignette is the like difficult, like you grab onto something and it's hard to let go. But they didn't give it to you this time. Instead, this time what they gave you was a high arched palate, wasting of distal muscles, and hypotonia, with a fish-like mouth, which as it happens, it's fish-like because the muscles aren't growing very well because of the myotonic dystrophy, which is really cool. Next up, good Lord, this was just a nonsense section, and you still did pretty well, and this is a nonsense section. Sternotomy. Never seen this as an answer choice before in my life. Sternotomy is the right answer in this person with hypotension, muffled sounds, and JVD. What does that sound like? Tamponade. Okay, well, they don't want tube thoracostomy because they only want tube thoracostomy if it's a pneumothorax. They don't want DTE because they really only want that if that's somebody who's stable with a aortic dissection. And they don't want CT angio because they want that if it's a PE. And they don't want chest x-ray because they want that. Pneumothorax, rib fracture, hemothorax, alveolar hemorrhage. So this person, they wanted you to do a sternotomy. Okay. Don't delay it by obtaining imaging. Just do it. Cool. Thanks, guys. Good medicine. They give you a study question, and the study was telling you that most of the people in it had a 64% or 66% or so of FVC, and the person in your office comes in with an 85%. And they don't give you a standard deviation, but it's basically your guy is doing 20% better than theirs, and he wants this new drug. And you're supposed to tell him no, because the new drug is for people who are sicker than you. Next up, you've got a lady with like all of the reasons for all of the things, okay? She's done cocaine in the past. She's not doing cocaine currently. So abrupt placenta is not as likely. Okay, so she's got a poor weight gain during this pregnancy with a low BMI. Possible that she's going to have fetal growth restriction, but not as likely as the answer. Okay, so she's had a C-section in the past, but just one time. So it's possible she'll have placenta previa, but it's not most likely. She's had a C-section in the past, so it's possible she'll have uterine rupture, but it's not as likely as the preterm delivery. Now, why are they so confident? Why is NBME so confident that they can tell you it's preterm delivery? Well, because she's had preterm delivery before. Okay, so this is like 2 paragraphs worth of info, and we're sick of it. We're sick of reading it because we've done a million of these. And now they're playing the game where the one that was the most likely was the one that they hid in there and just happened before. And then they ended on another. I mean, this is crazy. I don't know what we got right on this section, but I know the 10 wrong that we got. Not feeling too angry about the 10 because this one, they have a bilateral pneumothorax, y'all. Bilateral pneumothorax. Can you believe it? And what are you going to do for that? You're going to insert a needle on the left and the right side. I mean, I would have wanted it. We were thinking about it. I mean, I would have wanted to do it if it were one-sided. So if it's bilateral, stands to reason you just do it on both sides. Okay, 23-year-old dude. He'd been in a motor vehicle accident. Is hypotension, distended neck veins. They don't give you the muffled heart sounds for like a cardiac tamponade. They just say breath sounds are absent bilaterally. So then that's why they're saying it's that they feel safe that it's a bilateral pneumo. All right, that's it for that one.